A lot of times videos come to me when I talk to patients, and so this video log is about really understanding how young should you go when you're designing a face. And so that term, that concept is very vague, because should I go to 20 years old, 30 years old, 40 years old, 50 years old? Is there an absolute standard that I have to achieve to make someone attractive? And in this video, I'm going to talk about the vicissitudes or the variations on conceptual elements of what makes someone attractive based on age. So we're going to talk about women first, okay, before we talk about men. With women, there is a thought that maybe the younger I make a woman, the more attractive she's going to look. And in a way that's true, in a way that's not true. So what's interesting with women is that, and this is in some of my other videos, and I'll repeat this comment, is that women oftentimes don't like their face when they're in their teenage or 20 years because it's too round and full. And so what they oftentimes like is a face, oftentimes in their late 20s or early 30s or even in their mid 30s. Some people like it later, some people like it younger. And it's important for me as a physician or a surgeon to understand that, so I can design a face that is more acceptable based on that age bracket they see. Now, the reason why they don't like, as I mentioned, is that their face was too full, becomes thinner, 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 becomes more gaunt, minus weight gain, because his weight gain obviously is one colluding factor. But just talking about general metabolic loss, they start to lose more and more volume, they become thinner and thinner. So women want their face a little bit more gaunt. So I always tell women, wherever you think you look the best, think about 4 years before, it probably looked too full, or 2 years before. Think about adding 4 years. If your weight is the same, it may look too empty. So designing a face based on that is important. The other thing I hear all the time, women come in and say, look, I'm not trying to look 20. And I totally understand that. But at the same time, I want to give you my counsel. Now, a lot of the things I'm going to say are not politically correct. I'm not here to try to be politically correct. I'm trying to be here to help you understand this. So when I work with women and try to make them happy, I usually design a face around early 30s. But then I've got some women who come to me in their early 30s and want to look better, so I move them back 5 years. So, and I've even got, believe it or not, it's going to sound crazy, a few teenagers. Now, these teenagers are not trying to look younger, obviously. Those are usually models, people that are in a competitive industry that want to look better. And so what I'm doing is creating facial balance, like designing, if their nose is too big and they don't want a rhinoplasty, I can redesign this portion to balance this portion. That's usually what happens. It's not, crazy teenagers with too much money. It usually has to do with more in the model industry, or just trying to look better because of disposable income. That's a quick aside. But here's what's interesting is that when I work with women, if they're single in their 40s, and having a dialogue with them and deciding what do they really want, how can I achieve their, for men, from a male perception of female beauty, is what men do like a face that is much younger because it's more fertile. We have the societal component of looking back and saying the more fertile a face is, the more attractive. And so a lot of heterosexual men that look at a female like a face that's probably in their early to mid 20s. So when I work with some women in their mid 30s, 40s, and I ask them what they're trying to achieve, if they're single, I also incorporate some of those elements of saying, okay, I know what a man wants. I'm a heterosexual male. I can see what the design element is. I may make them a little younger. Now, I'm not going to make them look off by make them a little bit younger. Now, when that's not sustainable is if there's a ton of sun damage, if their face has significant elements where it looks older, or if they're way overweight down here, I can't push them into their early to mid 20s because it won't look right. It won't look balanced. So usually it's a woman that's relatively fit and tight in the facial features. The sun damage envelope is not so bad, or I've got them laser to look better, and I'm looking at the signs of aging that balance well. If possible, I will make them look a little bit younger than maybe early 30s, because I know on the social marketplace how to make them more attractive to the opposite sex. So this is a very complex psychosocial discussion about beauty that I hope is not offensive to you. It's really meant to educate you and think about these elements. Let's talk about men. With men, the level of complexity is much higher. And the reason is several-fold. Number one is women oftentimes are not 100% looking for male beauty. They're looking for other signs. There's these other factors, such as when men have greater stature, maybe their voice, their projection, their socioeconomic ranking of where they are. There's these other cues that draw women to a man just beyond physicality. Now, physicality is important, okay? Brad Pitt looks good, but what I'm saying is that there's other elements, and so discussing with a gentleman, what is his motivations to get there? So in other words, if I make a male too young, looking. A, it may not look as good in societal constraints. Number two, it may not be as productive when it comes to business because he looks too juvenile. It's not going to help him. And he may not look more attractive. So if I'm dealing with heterosexual men that are trying to look better in business, look a little bit better, a little bit more refreshed, what I think about, there's also a male bell curve where men sometimes look a little bit better in their late 30s, early 40s, mid 40s. Sometimes they peak in their 50s, and then I think they start to look worse, where they don't look as healthy, they don't look as vibrant. So for men, you always hear men look better with age. I think to a certain point, they look better and then they look worse, but that's shifted over at least by a decade to women. So this bell curve, as men get older and older, they get better and then worse. So where should in that bell curve should I move a gentleman? So if that is up to the man helping me make this decision, because a lot of times a guy will say, I look good enough. So I will get them to a point, stop there, and that's obviously with fillers and things like that if I'm pushing them back. But there's some exceptions to this. Number one, a gentleman that says, look, I really, really want to look more youthful. It's part of what my identity is where I thought I looked the best at 33. Boom, then let's move toward that photo. Let's get closer to that. If that's really where your heart and passion in life would be, let's move toward that goal. It may not be 43, etc. The other thing is if a gentleman's with a much younger partner, if he wants to look more at parity with his partner, and he's significantly older, let's say 15, 20, 30 years older, he wants to look closer to her age bracket, because as you know, there's a lot of men with younger women, then this is a way that I know how to get them closer to that bracket, and that is a driving factor, a driving motivating factor. Other thing, and this is not any negative commentary toward orientation, but homosexual men typically have a different worldview about attractiveness. So oftentimes they're much more fastidious and wanting to look more youthful. And so it's just in that culture. Now, not every single, I'm not trying to generalize and categorize homosexuals versus heterosexuals, but in the homosexual community, in the gay community, the standard for sexuality typically leans toward the younger side. So this is one of those things, again, that it could happen. And also in gay and straight relationships, you may have an older gentleman and a younger gentleman, and that older gentleman may want to look closer to that younger gentleman in terms of parity. So I know this is a very complex, emotional, psychosocial commentary. There is no absolute age for beauty and for attractiveness. It is a large part of these very large psychological dynamic cues that I work with in terms of my relationship when I consult a patient, when I discuss with a patient and look for objective ideas to get them where they want to be when they come and see me.